Okay, perfect.
Okay, so here we go. Good evening, everybody. Thanks for joining us. AI Literacy 101, getting started with AI in nursing. Dr. Irina Kaufman and myself, Susan Dean, and we're going to kick off this webinar tonight. And so, next slide. So this nursing continuing professional development activity was provided by the Connecticut Nurses Association and accredited approver of the American Nurses Credentialing Centers Commission on Accreditation.
Yeah, and at the end, if you stay towards the end, we'll tell you how to get your CEs.
Yep. Again, disclosures, there's no financial disclosures, there's no commercial support, and
Unfortunately,
yeah,
right?
and we're providing this solely by from our Nurses for AI.
Perfect.
So by the end of the session, we hope that you'll be able to define some core AI concepts related to nursing, identify some apps across care settings, evaluate, benefits, risks, ethics of these tools, describe the nurse's role in validating and governing AI, and then finally apply some basic AI literacy to everyday workflows.
Sounds great. Let's get started. I always say we have to know the history or we wouldn't know where we're going.
Yep.
So AI, believe it or not, started with Alan Turing, who was a brilliant English mathematician who actually helped us win the World War II by cracking the Enigma machine. And by different, people and different calculations, it's said to be that we either won it by few months or actually few years because we were able to interject Germans' messages and knew where they were firing. So he started it, but really this was math. But in 1950, he wrote a paper where he titled it, Can Machines Think? And this was revolutionary because he was actually thinking about kind of, what we now know as AI, machine thinking. And if you guys heard of Turing test, it's actually test that he created where a human is given a test subject where machine is talking to human or doing something and the human does, and you're blind and you're trying to figure out who is actually doing this. Was it a machine or was it human? So a lot of machines now are actually passing Turing tests because now we are very bad at actually figuring out who is on the other side of it. So that what started, but the name actually artificial intelligence was named in Dartmouth Summit Research Project by John McCarthy in 1956. I know a lot of us think AI started with ChatGPT a few years ago, but we're talking decades ago. And then 60s to 70s, it was really very primitive rule-based machines. They couldn't really think, but you could program machine to basically, do certain things for you. In 1990s, machines became smarter with our computers evolving. They were able to solve complex problems. And in 1997, and I remember this because I'm from Soviet Union, the machine, AI, we called it computers at that time, won chess championship by Garry Kasparov, who was the world champion in chess. And this was, people's minds were blown because everybody were betting on him. So this is where a lot of really smart people, unfortunately not me, started thinking, oh, maybe we need to get into AI and and learn that. So now by 2020s, AI kind of became everywhere. Of course, things like ChatGPT and co-pilots, they're becoming a really, everyday thing for us. But we just wanted to take you back a little bit to say that kind of the key message is that AI did not suddenly appear. And even though Susan and I are both what we considered or it's considered by industry as early adopters, we really got into it a few years ago. But again, some of our teachers, were in it for probably a decade or so before. So history is important. So let's think about what is AI really?
So really, it's AI is computer systems that learn from data, and they're there to perform tasks that normally require human intelligence or human contact or input. And so if we think about that, um, it does require still human input. Next slide.
Yeah.
Yeah. So here, examples of that. Many of you probably already know that there's early deterioration alerts. We have that in many of our nursing specialties, whether it's in the ICUs, PACUs, med-surg floors. And what AI does is analyze vital signs labs and nursing assessments, and they take all that data and they actually predict. That's what they're doing, is predicting and warning nurses that, this patient is, impending for or a high risk for sepsis, respiratory failure, or cardiac decline. Um, uh, and these can be, detected far earlier than our traditional scoring tools that we used to have. Another example is a fall risk prediction, which we've used for many years, but AI reviews mobility notes, meds, prior falls, cognition, and they really have a more robust input into our, compared to our other fall risk assessments. And this really helps nurses prioritize rounding, safety interventions, family input, talking to families about fall predictions and risks. And then finally, pressure injury preventions. Again, a high risk for pressure ulcers, but really taking in a lot of data and then making a predictive score for these patients so that nurses can decide, have an earlier alert system.
Perfect. Thank you. And I just want to add, I talked to a nurse recently, and she said the fall prevention, they use the AI protocol in her unit, and what it helps with is something that like you can't really go back and look at every admission prior to see, did patient fall before? So we only have so little time and so little memory. But AI kind of looks at everything and says, oh, wait, every other admission that patient had, they fell. So this is, again, this is where it kind of looks and takes that information from years of
Yeah.
data.
So the important piece here is that they not only looking at present data, but they're looking at historic data and then
Correct.
making that alert or prediction for the nurse.
Perfect. Yes. Thanks, Susan. So just to kind of highlight the difference between AI and what we say as traditional software is that traditional software is very rule-based. So I remember working in ICU, we had continuous vital signs monitoring. So I could program and say every time systolic is over 140 or 150, alert me, let me know, right? So it was very human input on when to alert. And sometimes if you guys, you work bedside, you know that, fatigue is real. And a lot of nurses are, well, let me see, I'm sorry, I'm admitting people. A lot of nurses get fatigued with the alarms. So they go, higher, 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 and then sometimes you miss something. AI is the program where it ingests the data and actually becomes smarter over time and looks at something where it'll say, for example, hey, I'm alerting you because this patient's systolic is increasing by 2 points maybe every few hours. So instead of waiting until somebody strokes out and have, systolic of 200, it'll tell you when they're at 150 that, whoa, in the past 4 hours, he went from, 140 to 150. So this is the difference between AI and traditional software, where it was very manually based on just rules. And that system could not think for you, could not tell you, wait, be careful, you need to pay more attention to that patient. And again, just to kind of keep in mind that traditional software was very predictable, but very rigid. And AI is adaptable and requires nursing validation, though, because AI could actually, there's also a lot of talks now that people are becoming also tired or fatigued by these AI um, predictions, because if you can imagine, AI is ingesting this, historical data for, 20 years ago, and now I did read this study where the hospital adopted AI program that was used in another hospital, but they had very different patient, they used the same EMR, Epic, but very different patient complexity level. And the other hospital didn't have as many complex patients. So a lot of their patients were kind of alerting. So this is something that you also have to keep in mind. So we'll talk a little bit about vocabulary because it is AI health literacy. So things that you need to know, you probably heard of, is machine learning. And machine learning means that there is an algorithm, there is a formula that's written that learns from data and it does improve over time. And so for nursing example, it's something like, predicting fall risk or sepsis based on this data of vital signs labs. And if you can imagine, if that A so every AI program, platform, whatever you want to call it, has to have a big database for it to learn. So the bigger the database is, the better it becomes. And then the more data is feeded into that AI, the smarter it becomes. But that's just machine learning, which means you give AI data, it kind of learns from it, and it becomes a little better over time. Deep learning, it's something, if you can just say, machine learning, big thing, big umbrella. Deep learning goes deeper. This is the machine learning that uses multi-layered neural network that can analyze really complex data, stuff like images, sounds, handwritten notes, voice over. So it's not just the data set that is being, fed to the AI. This is something that uses multi-layered complex information and then is able to provide something out of it. So think machine learning kind of more basic, and then deep learning is more complex and way more with way more umph. And so nursing example, for example, deep learning analyzes real-time EKG, oxygen saturated, respiration pattern, blood pressure, and detects very subtle deterioration, and then tells you, look, this patient is in risk for early respiratory distress. So that's a deep learning in terms of nursing. Um, then if you heard, and probably you have, natural language processing or NLP. This is AI feature that enables computers or the platform to understand and generate human language, both spoken and written. And I actually looked it up to make sure that I'm correct, but Siri is considered one of the kind of the first NLP because I was like, wait, we talked to Siri for so long, nobody thought about it as AI, but Siri used that natural language processing where you can say, hey Siri, play this and that. So that's NLP. And NLP in practice, for example, for nursing, it could be that, let's say, nurse is, saying something or writing something, and that program will actually draft, let's say, the visit summary based on the conversation that you had with the patient. It's called ambient scribing, and we'll talk about this in a little next slides. But basically, it does take your spoken language or maybe handwritten language and converts it into really structured text. It can also extract, for example, medications or allergies or, problem list from free text notes, and it can parse unstructured documentation. So you can, within NLP, you can actually like download the full medical record, maybe different medical records and medication list that's written by hand and discharge summary from another hospital. So it's unstructured and it can parse everything and kind of come up with this beautiful, some sort of, thing for the patient that is structured and easy to understand. It can also translate. So think language, right? Natural language processing. It can translate, for example, whatever you'll put in, let's say discharge instruction in English, it can translate it to Spanish, Russian, whatever you like, and it can take really complex language and make it patient liter, patient on a, you can program it to be, 10th grade level, and it can do that. Again, that's all part of NLP. Another vocabulary that you should know is, and you probably heard, it's generative AI or Gen AI, as people in the industry call it. And this is something really, to me, kind of, it was earth-shattering when I learned because Gen AI can actually create new content like text or images or audio based on the training data. So for example, Susan and I, when we make posts on, Facebook, you guys all came from Facebook or on LinkedIn, and we put our pictures in, we say what we want to say. Gen AI, it creates totally new content. It takes our pictures, makes totally different image, and sometimes it's not correct, and sometimes it makes us older, sometimes younger. And it can do audio. So this is like a next level of AI, Gen AI. And in terms of Gen AI, Susan, I'll have you take it away in nursing examples.
Yeah, yeah. I mean, again, remember, Gen AI is talking about generating new content. So basically, it's taking, nursing notes or shift summaries or SBAR communications and drafting a new one, for the chart or for what you want to document. But obviously, that's there for nurses' review. It's creating patient education materials that you can tailor to, again, creating new content. So here's the diagnosis, here's the level, literacy level, here's the language. So it's really all about new content. And then finally, like I said, generating handoff summaries from the EHR to support safe transitions of care. And that's really your SBAR. But it takes all of that information and creates a new draft of something. Now, I do want to iterate here that these drafts aren't just there to put out. It requires nursing review. So generative AI overlaps with NLP, but now not all generative AI is a subset of NLP.
Yeah, it's hard to kind of understand, and
That's a
yeah,
different concept here.
we might go deeper into it in one of the
Yeah,
next webinars, but I remember that it took me a while to understand the phrase that all hospice is palliative care, but not all palliative care is hospice. So it's
yeah.
one of those where you have to really kind of get deeper into it. But this is just for your, overview. So more vocabulary. What's the relationship between Gen AI and NLP?
So NLP is a field of AI. And again, it focuses on enabling computers to understand and interpret human language. So it's reading, classifying, translating, summarizing. So again, your scribes, taking all of your information that you are writing even and putting it into a summary. Generative AI is a broader capability that enables machines to, again, create new content. So natural language process is taking from whatever is there. Generative AI is bringing into new content.
Perfect. One of my favorite decision trees. Again, I talked about, when you work in, I mean, any unit doesn't matter, but you have the, vital sign monitoring, and you program it to say, hey, beep if systolic is over 160. The way the decision tree works is it's all on the back end, so you don't see it, but it's programmed. And this is where, again, nurses need to be at the table when it's all being done, because a lot of the new AI platforms that are being developed for nurses, for doctors, for the hospitals don't really have nurses as clinicians going over it. And there's a lot of doctors involved. And so let's say decision tree is if patient systolic blood pressure increases by, 2 points every hour, and the respiration decreases by, 1 breath per minute, every hour, and the pulse increases, and they're, whatever. So then these are all whatever, we take in that. And then it goes down to what do we do? Then we are, alerting nurse, and then we are telling nurse to check the vital signs, to talk to the patient. If patient, the question to ask is, how are you feeling? Are you having any pain? If patient says yes, you do this. If patient says no, so you do that. So this is all written on the back end. And again, as Susan said, as nurses, you have to always make sure that whatever AI is being implemented in your clinical settings, like you should ask the question, like what, and use these words like clinical decision support, CDS, where nurses involved in it. And always know that everything that comes out of AI should be validated by you, because it could be all correct in terms of the steps, but maybe it's totally not correct for your patient.
Right.
But I like to show you that because it makes it easier to understand how the AI is like written on the back end.
Yeah, I think before
Yeah,
we go on,
yeah,
I just want to talk about support. I think the key thing is support. Like if you're getting that information from the AI, well, look at the patient, right? Look, make your assessments. Does this make sense? If it doesn't, then we're not going to just blindly go with AI recommendations. So I think that's where it supports our decision. It does
right.
not make our decisions. Sorry,
Beautiful.
go ahead.
Thanks. Yeah, that's amazing. Yeah, yeah. Um, Now this is one of my favorite subject to discuss, but it's pretty um complex, and I can tell you that it took me I want to say a few days to get it. So I'll do my very best to give you in few minutes kind of overview of RAG, which stands for Retrieval Augmented Generation. So just, I love RAG because it just, I don't know, it sounds cool to me. But it's the approach of AI where, well, let me just tell you a little differently. So imagine, you are on your intranet in your hospital, and maybe you work in ICU, and you wanted to search a policy for, how often do I have to turn patient, let's say. If you just say, you're searching for policy in your full intranet, you're going to get policies from ICU, emergency department, rehabs, everything under the floor. So you're not going to know, like, you're like, okay, well, I have now 500 policies, or I have one general policy. RAG is where you can actually look into your own policy of your own unit, and you don't have to think about, you don't have to say, I'm looking for my unit policy. So what RAG does, it's ingest the internal things like SOPs, policies, procedures, maybe evidence-based articles. So anything that you are using in your settings. And then when you use that AI platform and it has RAG written into it, then when you're searching something, it is completely and 100% linked to the information that is appropriate for your, unit or institution, or whatever it is you're doing. So the examples in nursing, let's say, is for example, if you're asking any AI tool, like what is the protocol for managing a patient with suspected sepsis, you're going to get a lot of different information. But with RAG is going to generate generic answer based on your training data. I'm sorry, without RAG, it generates answer based on generic data, and it could be outdated, incomplete. You just don't know. But with RAG, when RAG is built into the system, you get your current sepsis protocol from your EHR or policy manual. It actually generates a draft response, and it'll say, according to your hospital unit protocol, the nurse should do blah, 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 blah. So what's important, and you're going to be golden if in any of your meetings, if you are maybe reviewing, a few vendors that are coming in and they're pitching, the AI model, you should ask, have you used RAG in your model? And if you used RAG, is it our current information? And again, I'm telling you, you're going to be golden because everybody's going to look at you and think, oh my gosh, this nurse knows what he or she is talking about. But like with anything else, Susan and I are going to continue to say that whatever is being generated, even if, they use the RAG and you verify that, you still need to confirm the accuracy, because I look at it this way. It's almost like, remember, Susan, when we worked the floors, you always had that nurse that's been there for 15 or 20 years that knew everything, and you could ask her a question and you will say, oh my gosh, help me, remind me, what do I do in this situation? And she tells you. But if you didn't follow up and actually check your policies, and maybe she told you something wrong, it's still your license. So RAG is something like that. The nurse that's been there for long kind of knows what she's doing, but she could be wrong. So
Yeah, I
trust
mean,
by verify.
yeah, I think it's just remember to be, it's your professional responsibility, whether it's the nurse who's been there, for a long time, or the AI tool, is that you do still have to verify the validity, accuracy, and reliability.
Perfect. So Susan, how does AI learns without a
Yeah.
math?
It's not math. We don't need that. Well, the biggest thing about AI is that it really relies on data, a large amount of data. And we already looked at that with machine learning, right? We talked about tons of data that allows to look at patterns. Example here is, AI could say, oh, here's a bunch of rules to identify X-rays that are uh, labeled pneumonia. Instead, what they've done is taken thousands of images or thousands of X-rays that are labeled pneumonia and not pneumonia and put it into the data set. And that's how the AI learns from patterns. So that's the most significant thing. And then from those patterns, they're able to look at risks, you know, predictions, etc.
Yeah.
And so, it adjusts to reduce errors. That's what it's there for. But remember, the data that we put in is only as good as the data we put in. If we're putting in incomplete data or data from not inclusiveness, then we are going to see biases. And those biases will lead to unsafe outputs. And that's where, again, we have to look at, we're the stewards of this. We just can't blindly accept what AI is producing.
Yeah, and like we always say, we need to coin this phrase that AI will not replace nurses, but nurses who understand AI will really shape the future of healthcare.
Absolutely.
Again, I don't think there's any fear of AI replacing us, but nurses that do not get it, they don't want to get involved or know it, I'm afraid are going to be left behind.
Yeah.
So, American Nursing Association came out with their position statement. Susan, do you want to talk a little bit about it?
Yeah, I mean, I don't want to run through this,
Yeah.
but you know, it's not a replacement of the core professional values as we talked about. We need to make sure with any technologies, and we've looked at many. I remember when we went from paper documentation to EHRs, right? Have to be there to make sure that we're not compromising any interactions, and that nursing and nursing judgment is still at the core of the profession. We need to be proactive. We need to make sure that we're evaluating the impact of AI, and we need to also raise our hands if we see something that is not consistent with reality, right? If you're using AI tools in your practice and it's not jiving with, like I said, your patient assessments, your patient what your patient's looking at. If that's consistent, that needs to be red flagged, and then working with IT and administration to see how those things can be improved.
Yep. And AMA said that nurses should remain well informed about AI, and hence we are doing this webinar. We are
Yeah, there
going
you
over AI. So, why is AI important in nursing? It really, I don't want to run through this. I think we already said that, but there is a lot of there's a lot of uh, pros and cons, and like with everything that we do with new technology, with everything, there becomes a lot of great but also a lot of caution. So it can reduce burden, but it can also add burden, because now you have to read everything that AI spit it out and make sure that you agree with it to sign your name. It can really help with patient safety and quality, but yet nurses can become really fatigued with a lot more alerts. And again, it's like it's not coming. It's already here. So let's talk about what we can do to help you get better at it. But we just wanted to showcase few studies that we pulled that says that documentation time for nurses went down. About 50% of nurses reported burnout that's linked to administrative load. And this pilot that was done in 2025 showed that between 30 and 40% of time was reduced in documentation by nurses. So this is great, but and the other great thing was that patient understanding went up when they utilized AI in discharge summaries for patients, and they made it very patient friendly in a language and format that patient could understand. It improved understanding by dramatically. So patient readmissions were lower. This is all great. Um, and what was used in some of these studies, it's something that it's called ambient scribing, and it's probably pretty much everywhere now. I think, I went to a few doctor visits and they said, oh, by the way, we're using ambient scribing. Are you okay with it? Which, of course I said yes, but this is where transparency comes in. But what ambient scribing is doing right now, it really is capturing conversations. I've talked to actually one doctor, Susan. He works, oh my gosh, I want to say emergency room. I forgot. But he said he totally stopped, like he doesn't do any charting with patients anymore. He loves Scribe because he verified and he made it better because every time he was catching mistakes and that Scribe became better and better. But he was like, I'm talking to the patient, I'm getting everything, and then Scribe kind of gets everything typed and printed, and I just review it and signed. So it captures conversations. It does save time. It improves the workflow and everything. But again and again, you have to review it. You have to edit it. You cannot assume that it's correct because it can sound really confident but be incomplete. And not only that, sometimes it can hallucinate, which means, it's going to be wrong information. But with scribing, what's happening right now is scribes are not very good at English second language. So with accents, they're not very good. If patient has a caregiver inside the room and a doctor and a nurse, scribe doesn't know who's talking. So sometimes it could take what the caregiver said and think that this was a nurse or a doctor. There was a case where somebody walked by the door and they were discussing their lunch, and Scribe said, it was something, something hamburger. So you always have to check for accuracy before you sign. But overall, people do find it very helpful. So that's ambient scribing. Um, Gen AI in documentations, for example, for nursing, it again, you already probably know, and we're repeating a lot, but we believe in, repetition is the key to learning and gathering information. But if you remember, Gen AI can produce output based, to new information. So what maybe nurse is, thinking about when you're typing, it kind of, thinks for you and predicts the next word, so it can make you write much faster. But you have to be careful because sometimes we only see what we want to see, and sometimes we sometimes don't catch the mistakes. But it can help in drafting progress notes and care plans. It can rewrite patient education at the fifth grade level, sixth grade level, 10th, whatever you want to tell them. And it's really good at creating shift handoff summary based on all the information that you already documented. Again, you still need to verify, but those I've seen being a lot more accurate because they're not, they're already looking at information that was written, and it just kind of summarize it and creates the shift report. Again, review, correct when needed, always correct, because the more you correct that AI, the better it learns and less mistakes it makes at the end. So don't get frustrated and be like, oh my gosh, this is wrong. Because I have a friend who's OBGYN who kind of stopped using Scribe and AI in her practice because she was like, I just got tired of correcting it. So when I explained to her, the more you correct, the better it becomes, then she was like, oh, I thought it's going to make mistakes forever. So this is one of the things, correct, 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 before you sign. Um, I would say the one of the very first AI things that were introduced to healthcare before I knew it, or maybe Susan probably didn't know, it was in imaging. So imaging, radiology, ophthalmology, it was used for, I would say, decades before we knew. But keep in mind, don't get scared and think that AI looks at, every X-ray and says, oh, this is cancer, this is pneumonia. It doesn't do that. What it does is it it alerts the radiologist. Radiologist is always the first and the last to, well, the last to look at the imaging, but it alerts the physician and says, look at this, look at that, make sure you double check this. And it's better than human eye, but in studies, the best work was done with AI and radiologists. It's never just AI. AI does not win by itself. Radiologists do not win by themselves because we, as humans, we get tired. But AI with radiologists, it was amazing. But again, they've used it for decades. And fun fact, a few years ago when I had my mammogram, I had to pay like 59 or whatever dollars for the, AI thing. And I didn't pay that. I was like, oh, I don't know. I don't, I was a little skeptical. But once I've learned how amazing AI in mammogram, the last mammogram I had 2 years ago, I was like, oh, I'll pay for that. But it was already included in my, I didn't have to pay that extra because insurance already covered that. So, and the studies have shown that there were really, AI is really helpful in mammography because it alerts doctors to look at something. Again, we talked about, sepsis early warning signs. I'm not going to get into that more, but it does monitor like all the data, and based on the historical data, it will give you early warning sign. I think the key is early, right? As nurse, and I always say, I remember walking by patient room, glancing, walking further, and then stopping. And I was like, oh gosh, like this patient's gonna crash. Like you just knew it. There was something like like the gut feeling. And it was just our gut feeling, right? And we could be right, we could be wrong. But if you wait for alarms, it's too late. But AI does it for you way, way earlier. So the nurses, we can intervene earlier, check the patient, and then kind of figure out what to do. Same thing with, I think I've seen it work with sepsis alerts, probably better than anywhere else because the data is so, there's so much data, and AI looks at everybody that had sepsis and analyze what's changed with them an hour before, 2 hours before, 5 hours before, 10 hours before, by minute. And then when it kind of catches that with another patient who might look totally normal to you right now post-op, they'll say, oops, look at this patient. He's at risk for sepsis. So that works amazingly. Again, fall risk and pressure injury. Remember, this is all historical data. It looked at 100,000 or sometimes millions of charts and data and analyzed why did this patient had a skin breakdown or why did this patient fell. And so it gives you way earlier sign to intervene before it actually happens. But we'll have to wait and see at how much it actually helping people catching, because it's hard to, I think, not documenting, but if somebody didn't fall or somebody did not had a skin ulcer, like how do you connect that to the AI, right? So we don't know yet, but hopefully more data will come, so we'll know the predictive of this models. And I personally do remote patient monitoring for my patients, and AI is amazing in remote patient monitoring because in my in the machine in my platform I have a alerts, and I set them, and I said alert me when patients systolic is over 160, or some of my patients sometimes they run so low, maybe their diastolic is they always are at 55. If I'll set it to 60, I'll get alarms all the time, so I'll say 54. But AI can actually alert me before and say, look at this patient, like something is not right. This patient has been, fluctuating too much, or say every Saturday patient's blood pressure drops or goes up. So it's really good because as human, like when I look at the data, it's so much data that it's hard to sometimes, it might take me half an hour to make sense of it. So if I use AI, it's like boom, 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 boom. I can see it, I get it, and it works amazing. And patient communication, Susan.
Yeah, I mean, there's so much going on now. I was at a webinar with the American Board of Paresthesia Nursing, and they're using chatbots, but they're also using AI to send out patient communications. This is with the Children's Hospital of Philadelphia, and so they're communicating with parents, and they've gotten more responses than they ever have before. using the AI platform. So the benefits is that, parents, whether it's parents or patients, we want to make sure that we have a communication to folks, not just Monday through Friday, 9 to 4, right? Things happen on the weekends, on the holidays. So how does that get access? How does that communication occur? And look, AI is not going to tell you specifically, but they are going to be, there's going to be kind of, uh, kind of triggers that to say, call 911, go to the ER, go
Yeah.
to the emergent care or whatever, so that, that some of this communication will help benefit the patient and make sure that there's less inaccuracies and less side effects.
Yeah, and chatbots, people love them, people hate them. Sometimes I hate them, but sometimes it's easy if if you just have a question like, What time does the office open tomorrow?" Right? It'll tell you
Yeah.
it's 9 o'clock or 8 o'clock,
Yeah,
or
yeah. So there was a study that when emails coming into the nurse, right, it decreased their response time by something only by something like 20 seconds. But if you think about how many emails nurses, like in a private
with the
practice or
triage, right?
whatever, right? If they're doing how many emails per day, per month, per year,
Yeah,
that translates to a lot of time.
agreed. And remember, I think the same study said that AI actually uh kind of like the match emails to say that these patients need medication refills, these patients need
Yes.
they
Yeah.
have a medical question or whatever, so it was so much easier to just open,
Yeah.
oh, refills, boom 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 boom, you've done it, versus actually reading every email and trying to understand. And you can also prioritize, like, hey, medication refills I might do early in the morning so they can get their medication on time,
Yeah.
versus well, whatever. I think with I I feel sorry for the nurses that are, doing these triages, because everything is always urgent. Like, how do you
Everything.
labs, medicate, right? But
But here it will, I think, does help with the time,
agreed,
the time. Yeah.
agreed. Yeah.
So if we're looking at staffing and workflow, it can predict census, acuity, workflows. I know I was at a conference where ED physicians were looking at, peak times, what's the triage, what the staffing they need as far as nurses, PCTs, physicians, all of that to, again, safer ratios, less burnout, and then really advocate for safety. There's always going to be blind spots, right? You're always going to need human oversight for these. But the overall workflow and staffing that can be produced by AI can save a lot of time that then just the human needs to go in and verify, clarify, tweak, whatever it is.
Agreed.
In education and simulation, we know that AI is really being used a lot in the education platform. Adaptive learning, using creating simulation scenarios that can be scalable, that can be adaptable to be, shared with other simulation labs. The biggest thing is that you can align them with competencies, creating debriefs, especially for, um, nurses who are maybe just getting hired into sim labs and in education, that can really be a helpful, jumpstart, right? Like sometimes
Yeah,
it's like, I know when I started in education, I'm like, where do I start? How do I do this? And then giving AI a simple prompt and helping, how can we do this, will help their job a lot easier.
agreed. Quality improvement and research. I mean, it's amazing in my mind. I use it all the time for, like, scanning the literature. I do use Perplexity for things that are, that if I'm looking for evidence base, but you can really very quickly look at the literature, trying to find information on, what's the best for this or for that. It's amazing for like data-driven projects. I think what a lot of people still make mistake is they use ChatGPT or whatever AI for like email writings, and I think this is, I hate to say it, but it's almost like immature use of it because what ChatGPT can do, and when I say ChatGPT, I mean any AI platform of your choice, is like it's so much more than just writing emails. So for example, like right now I'm trying to figure out how to create a AI agent that can actually search something for me, come up with a summary, and alert me of the new things that are coming to the industry because it's almost full-time job looking for, things that are happening right now in the world of AI and nursing. So it like the opportunities are just tremendous. And especially in research, I wrote multiple like a research papers, and I remember that it took me, I would say not hours, days and days of just
Months,
researching PubMed,
months.
right? Oh my gosh, and search words. And now you can just, get into Perplexity or other similar AI platforms and say, I'm looking for, these articles, evidence-based, that's the year that, and boom, like you have them. So you
Yeah.
can ask them to summarize, to analyze, to show you which ones to read. So it really is amazing. But my only caveat is don't use it as in don't use it as your brain. Like don't have them think for you. Have them give you information so you can think better. It could be faster. But there was a MIT study that was done on students recently where they were giving three things. One group was giving just paper and pencil and like write your essay without any technology. Another one, you can use Google only, like search. And the third one, you can use anything, including AI. And they were doing functional MRIs. And if you can imagine, people that used AI became a little dumber. So we have to be careful to not, have AI help us be smarter, not dumber. And like with everything, because it's data and data could be incomplete or inequitable, not because somebody was wrong or they did it on purpose, but there could be a lot of biases and unfairness because of the data might be incomplete. Meaning, for example, when Susan said, AI analyzed, thousands of x-rays of maybe, patients, pneumonia or not pneumonia, but imagine if maybe those patients were only females, or the patients were only males, or they were only children, or they were only 65 and over. And I'm not saying it's good or bad, but what I'm saying is if you're missing certain population in your data, then the data automatically becomes biased because you only see one type of data. So there were, I mean, a huge lawsuit for pulse oximetry companies where people were actually dying during COVID because pulse ox were measured for their studies on light-skinned people. And so what happened is with dark skin, pulse ox was not alerting for hypoxemia and people were dying. Like people with dark skins, the pulse ox could not detect it. So there was a huge lawsuit. Again, was somebody biased or racist? Or I don't think so. I just think that they didn't think through. I mean, they could have been, but I don't think they thought through when they did the research, and they just used like whoever came up, and maybe just lighter skinned people showed up for that. And same thing with skin cancer. They were analyzing thousands and thousands of slides, but they were all light skinned people. So melanoma was missed on darker skinned people. So always, I would say, always assume that data is biased and always ask the right questions. But mitigation, we can do something about it. So we can, as nurses, we should be asking if AI is in our practice now. What kind of data set was used for this AI for study? Was the population that was being used as the one that we being served? Because again, maybe you're working pediatrics and you only want to see peds, and that's perfectly fine. But if you work in, family practice, you want to make sure that your data set included, anybody from children to, 120 years old. You have to try and conduct continuous bias testing, and we can go through that a little later. But there are certain algorithm and certain models and certain frameworks that can teach you how to uh, test for bias and how to continuously test for bias. And by the way, if you only do it once, doesn't mean that you're done because you always have to keep doing it. Um, and really, you should, as a nurse, we should always promote algorithmic transparency, meaning that you want to know how and why the AI make the recommendation. I can tell you that when I use, let's say, ChatGPT and I ask for some sort of recommendation, I can say then, why did you make that recommendation? Based on what? Show me evidence. And you'll be surprised that a lot of times, again, it sounds pretty confident, but it might be completely wrong or like hallucinate the data. So always ask for how and why AI make that recommendation. And if you're anywhere you work, if you're implementing AI, it should be ethical oversight committee in that place. And again, as nurses, we always think of how can we get ahead? How can we get, maybe, move up something. This is something that you can go to your, chief nursing officer and say, do we have an ethical oversight committee? Because we have a lot of AI platforms that are being utilized. And if not, I would like to serve in the committee. And boom, you're going to be golden.
So we have just a couple of slides left, and I want to leave a couple minutes
Yeah.
if there's any Q&A. So I'm going to go through these a little bit quicker. So when we talk about ethics, we talk about privacy and security. Remember, we already said that AI is based on a lot of data, right? So we just have to make sure that as nurses, we are protecting health, personal health information of our patients. Um, you know, AI vendors can store or train on sensitive data outside of our healthcare firewalls, but that's something that IT in your healthcare facilities really need to make sure that firewalls are safe and that nurses need to understand how those firewalls work. And again, cybersecurity is always a concern, but we really want to make sure that there are safety measures in place to make sure that security is intact. Mitigations is certainly using HIPAA compliant and ICE Trust certified AI platforms. So when institutions are looking at platforms, what's the safeguards? What are we asking? Asking the right questions. Requiring data use transparency, knowing where and how personal health information is being stored. And again, educating us on how is AI data handling and digital hygiene. Look, we are our patient advocates, so we need to be able to explain to our patients how their information is going to be safe, right? And so legal and regulatory snapshots, for the most part, FDA regulates many, but not all of the AI ML tools. That's an ongoing issue, and that's an ongoing question of if something goes wrong, who is accountable? But again, we need to know as nurses, as physicians, healthcare facilities, what those regulations are. Organizational policies must define acceptable use. Accountability always remains with us. We know that, right? And then always document if we've used AI and to make sure that we verified the output.
Yeah, and one of the ways, as I said, is try to join AI committee. It's very important, and the AI committee must include or should include different categories like doctors, nurses, physical therapists. So try to be that nurse. Try to define documentation standards, and we can help you with that. And establish feedback loop to report issues. So anytime AI is being implemented on your unit in your whatever office, you should always ask, okay, if I find, question, if I have if I find issues, inconsistency, hallucination, who and how do I report the issues? And that's what's going to stand you apart. And so Susan and I created the 8 AI domains of competencies for nurses. It is on our website. We're not going to go through it, but we are writing right now for Nursing Journal about these competencies. But we want to make sure that AI is being thought and very thoughtful. And so the nurses, like, anywhere you work, they're always competencies. How do you know that you're competent? You check the competencies. So we created that. And remember, AI supports, not replaces us. You always have to validate the output. You should protect the privacy of your patients. And we should lead governance and ethics. We should not think, oh, somebody else is going to do it. Because again, this is our time right now. It's your time as nurses to shine. We are the largest healthcare profession, but yet very few of us are in AI space. And AI literacy just improves safety and efficiency. Our
And
references,
if you
yeah,
go to the next slide, Irina, it gives them all the information. Yeah, they can
yeah,
and get your CEUs. But if there's any questions, we have like 3 minutes
yeah,
left. I didn't
yeah,
know if anybody else had any questions in the chat.
yeah. You can
Please.
unmute. I'm gonna stop sharing so we can see you. Uh, oop. Am I still sharing? Stop sharing 1 second. Oops.
Yeah,
Okay.
you're still sharing.
And guys, please, you can unmute yourself, but make sure you email me, or if you didn't get the email, we'll post it on our Facebook and LinkedIn. But you can always just DM me or Susan, and we'll send you the link to just a few questions about the webinar and CE, one CE. Am I able to unmute everybody?
So, well, they can, oh, wait. Okay. Can you post the email in the chat?
Yeah,
Yeah.
I will.
Can you
Oh,
do
we had
that?
a lot of questions.
Donna, can I ask? Yeah. Go
Uh,
ahead. Can you type it in, Donna?
Okay, I was trying
yeah,
to see if I could
Oh, there
unmute.
you go. Okay.
Can you hear me
yeah,
now?
Yeah,
yeah.
yeah,
Okay.
I can hear you. Yep.
I didn't have permission there for a few minutes, so I was
Okay.
okay.
Go ahead.
Um, Susan, we met in the course I took at CCNW for new clinical faculty, if you
Okay.
remember me at all.
Okay.
But
Yeah.
so I feel like, well, my son just finished a cybersecurity specialty degree in computer science engineering at UConn,
Okay.
and I've been talking with him and kind of thinking through is that, my thoughts is that how are my students using AI? How can I encourage them to use AI in the right way, in
Yeah.
ethical ways, because they're using it.
Yeah.
And so I want to support it and be, I don't know, knowledgeable about how to encourage them to use it in the right way and know what the heck I'm talking about. And so I've been kind of looking for something I could take online, but there are a million and one courses in AI from everybody. Jack Smith in his basement offers an AI course, and so I didn't know if you had any recommendations about a short thing that I could do that maybe a month or two long that would kind of get me rolling in that AI for academia sort of field.
Well, yeah, there are some courses that in academia for AI in academia, not so much in nursing education, but in general education. So Auburn University and San Diego State University both have free AI educator certificate programs. Um, Irina and I are partnering, I guess that's the right word, with the
Sure.
American Board of AI in Medicine, that is going to have a 1 day AI for nurses, nurse practitioners, and I believe it's Saturday, April 4th.
Fourth, yep.
Um, that
And I
it's
think it's
Dr.
only $300, right? And they're gonna give us
I think it's
25%
two,
off.
yeah, I think it's yeah,
Oh,
300 or 250.
yeah.
But we're working with them because we are going to be facilitators for that course. It's with Dr. Anthony Chang, who is with the Children's Hospital in California, and he's done amazing things. We both have done both his certification courses in medicine with AI, and he's heard the call for nurses that need education as well. That will be on our website, and we'll certainly send that out. I think the other thing is to visit our website is www.nursesforai.org. We have tons of resources. They're all free that can help educators. So check it out and see maybe that can help as well.
Thank you very much, ladies.
Thank you.
Thank you.
Does anybody else have any questions?
I think we are up at
We're
7:31,
okay.
and I think that ends it for today. Thanks, everybody, for coming. We've enjoyed this. We're going to do this again, and thank you for your support. Have a good evening.
Bye, everybody.